Okay, so see how my thumb pops over that right there?
Yeah.
That's a big knot.
Yeah.
That's going to cause pain for her in her everyday life. That's no good. Okay, so I'm just feeling in there deeply. For the knotted, tight tissue. Okay, I can get in deeper and deeper. Okay. And how do you work on these over here? Get yourself a little chair next to the table. I'm going to have to move it over so I can put the camera on there. And you get some oil on there. And on your forearm like that. And you hold it with this hand here. And you put that ulnar bone, okay? You put your forearm's ulnar bone right on there like that, and then you lean on it. Okay. That was a little too much, as you could hear. So now I'll just take a little off of that. So you want to do strokes all the way from one tendon here up to the other end, to the end of that muscle, those muscles here. Do different lines. Okay, so I'll do a stroke along here. I'll do a stroke along here. I'll do a stroke along here and alternate. So we're hitting different muscles. Okay. If she's tensing up too much, then, you know, it's okay to tense up to a degree, because what they're doing is they're fighting back a little bit, and a little bit is good, but too much is not good, you know. Some pain is good gain. Okay, so after you do a bunch of effleurage like that, then we do some what's called more petrissage, like that. This is kind of more of a feel-good yin massage stroke to release it. If you want, you can alternate with a little bit of this. You know, just kind of some relaxed type, shaking and rocking, releasing. And bear in mind, you know, when you're doing your self-massage, you want to try and work on your own body in these same manners. Okay? Okay, so you can see how swollen and tight that is. Just by looking at it, you can see that. Can you see all that? So, getting in there with fingers underneath like this and thumbs on the top gives you good leverage. Super duper leverage to be able to squeeze like that, see? And really use the power of your thumbs to dig that shit out of there. Okay, so watch. Stripping that out of there. Okay, so let's work on the foreleg muscles now on the sides. Also using my forearm and holding the ankle here so that I can push and pull. Pushing with my right forearm and pulling back to create stability with my left hand. Tibialis anterior muscle. Perineal, major and minor on the side here. Okay, so now I'm going to do a little ringing, okay? Followed by a long strip. Okay, so now look. See, I'm standing here at a really good vantage point to be able to just hold my arms stiff like this and use the weight of my body to lean on this stroke. Watch. Okay, so now I'm going to work on the foot a little bit, okay? So, the light isn't as good for this, on this stroke and view, but you can still see. Okay, so put my hands underneath the foot. This is exactly how I'd work on my own feet, because this is the same vantage point. This one feels tighter. That one also feels tight. But you have to get really good at feeling for what's normal, what's abnormal, what's tight, what's not, to be able to do good massage therapy. Okay, so let's stretch them out a little bit. Now I'm going to walk around to this side to pull the toes. Crack. Okay. So there you go. Some painful leg massage techniques.